Thank you for this opportunity. My name is Keith Rosiello, and I speak to you on behalf of the many incarcerated individuals here at NCCI Gardner in favor of an act relative to medical and elder parole. That said, we understand this potential opportunity carries with it our solemn obligation to provide reparations in any way we can to the individuals, families, and communities we harmed, no matter our physical, mental, or emotional state, because the compassion we ask for is also the compassion we need to give back to those we hurt. The plight of our elderly and disabled incarcerated population is dire because the system is, and always has been, ill-equipped to provide a level of care in keeping with the humane quality of life. Prison is not a place of compassion, flexibility, nor understanding, because rules, regulations, and regimen simply do not allow it. We all regularly watch the elderly and disabled struggle with physical, mental, and emotional difficulties. Physically, with the need to traverse stairs, hills, and inclement weather to obtain meals, medication, and participate in programming. Mentally, with the need to read and complete forms, file legal work, navigate healthcare, and cope with the financial struggles due to an inability to work or a loss of support from family and friends who may also be elderly and disabled or have their own financial difficulties, and emotionally in suffering indignities at the hands of less than considerate individuals, both incarcerated and not, due to difficulties with incontinence, maintaining personal hygiene, being fully aware of their surroundings, or even completing tasks in a quick enough manner. I personally live with a 79-year-old diabetic who has suffered 2 strokes and shows signs of dementia. And although I am there to help him, it is not enough to spare him from the embarrassment, low self-esteem, and trauma of living in a prison environment. A simple thing, such as his limited mobility, causes him multiple times a day to end up at the back of a long insulin line, making him late for meals and leaving him insufficient time to eat before he is marshaled out of the chow hall. We truly believe the elderly and disabled are entitled to a reasonable level of humanity despite their long past transgressions, and prison cannot afford them that as compared to being on parole. We know they represent no real threat to anyone, have a single-digit recidivism rate, and a disproportionately high cost of care. As such, their supervised release is commensurate with public safety and fiscally responsible for this Commonwealth. Our high percentage of elderly and disabled is largely due to life without parole sentencing. And by some estimates, Massachusetts is spending twice as much to warehouse these individuals as the 6 states around us combined. Yet our homicide rate is not markedly different from our neighboring states. Massachusetts remains an outlier when compared to other states, resulting in a significant and unnecessary cost burden on its taxpayers. Money that, if invested in crime, violence, and drug abuse prevention, youth programs, and education, would provide a much better return. It has been said that the degree of civility in a society is sometimes gauged by how they treat their incarcerated population, particularly true of our elderly and disabled. Thank you.
Thank you. Is there any questions from the committee? Hearing none, thank you for your testimony.